Well, there is some worry now that getting a CT scan at the doctor's office could actually be increasing your risk of cancer. And on the same end, they're saying that apples don't just keep a doctor away, they may also reduce the risk of cancer. There's other health issues like diabetes and high cholesterol also that apples are connected to. So here to explain both of those stories for us, we've got Louisiana Chief Medical Correspondent, Dr. Hebert. Good morning.
I am concerned about what I'm about to tell everyone. So this is something that I want y'all, I'm usually kind of joking, but this is pretty serious. Right now, that the whole concept of CT scanning, right? It's something that we get, we don't really think about it. We go to the ER if we had some type of head insult or if we have some type of issue with chronic illness, then we will get a CT scan. But there is a new study that came out of the Cancer Research Institute of London that says getting a CT scan could account for a whopping 5% of all cancers in the United States. That's about 9,700 cancers in the United States. Now, there are ionizing radiation issues that come with CT scans. Now, let's be very clear here. This is not an MRI. We're talking about a CT scan, right? And we get these all the time. But the issue now is that when we start looking back at all of the data, we see that the CT scans, especially if you've gotten 1, 2, 3 CT scans, that can be an increased risk of cancer. Now, I worked in the ER for 15 years, and we always would say, you know, if you get 1, that increases you. If you get 2, that's even more. Children are at bigger risk, all right, for blood cancers as well as bone cancers, right? So what do we do here, folks? Because CT scans have become in vogue, especially at some of these boutique salons, where you will get a full body scan to make sure you don't have any cancers. Well, this is a problem because it could actually be causing you some cancer.
Well, that was my next question, is say that, you know, you go to the doctor today and they say, okay, well, we're going to schedule you for a CT scan. If you need it, you can't really see.
Right, and that's the bigger issue here. What we must realize is that the risk has to outweigh the benefit, right? And well, let's say that the benefit has to outweigh the risk, rather, right? So when we look at how you get a CT scan as physicians, what we tend to do is we get a lot of pressure when we're in the ER, because say you come in and you fall down and you had some little nausea or a little dizziness, and you're like, I want a CT scan, I want to make sure I'm okay. And doctors tend to cave into that. So please, what I'm asking is, do not pressure a doctor into giving you a CT scan, because we are going to start being much more frugal about the way we do this. But the issue is that the insurance companies tend to not want to allow us to give the CT scan even when we need it. So doctors are in a very precarious position right here, because sometimes I'm fighting to get you a CT scan, and then I don't want people to say, well, I don't want that because it's going to cause me cancer. What I want you to recognize is that use your doctor's discretion to say whether you should get one. However, do not just say, I want to just get a CT scan for everything, because that's not where we need to be. Now, Brianna, when we start looking at this in the grand scheme of things, you know, what if you have colon issues? What if you have a child that had head trauma and had a loss of consciousness, okay? That's something that would require a CT scan if you had loss of consciousness in a child that had head trauma, right? But just remember, I want to be clear, not MRIs, we're talking about CT scans.
Okay, definitely something to talk about with your physician today if
Yes.
you are headed over there to do that. You want to talk about apples, because they're saying that. Let's talk about something positive
so
here.
something positive, right? An apple a day keeps the doctor away. That comes from something that's actually very real. We've looked at several studies, and one of them actually came out of the Journal of Food Science. And what this shows that if you ate 2 apples in a day for 8 weeks, right? And that's not drinking apple juice, folks, because that's already recalled. We talked about that from Leah. Not apple juice. It's not drinking apple juice. It is eating apples. They have polyphenols in them, which increase your insulin sensitivity, decrease your risk of diabetes, inflammation, and protects against lung, breast, colorectal cancer, decreases your bad cholesterol, and increases your fiber, folks. So the take-home message for today is, please do not get a CT scan if you do not need one, and make sure you eat 2 apples a day so you don't have to see my smiling face.
I knew you were going to talk about that today. The girls have apples in their lunch.
There you go. All right, but
And
we'll talk about that, the CT scan and work. I want
Yeah.
people talking about that.
That's
It's
an important one for sure. Yeah, great conversation here with Dr. Corey Hebert. Thank you so much for coming in. If you missed any of this conversation or just want to rewatch it, you can find it and other top health stories that we cover on our website, WWLTV.com.